Welcome back. We are going to see another type of Sata question from mania, that is from psychiatric topic. The question says, which behavior are expected in a patient experiencing acute mania? Select all that apply. The options here are A. Flight of ideas, B. Decreased need for sleep, C. Grandiosity, D. Slow speech, E. Poor pulse control. So the right options are A, B, C and E. The D is not the right option. Slow speech doesn't happen in mania patient. Rest all the options are right because they have all the signs and symptoms of flight of ideas. They're very much impulsive. That is, they are having poor impulse control. They are having grandiosity of their ideas, and they have a decreased needs of sleep. These all the options are correct except for the D option. So in all the psychiatric Sata type of questions, how we need to always assess is, we need to first see for safety, whether the patient is safe. Always safety beats the autonomy. So always if the patient is safe, then and the patient is in senses, then only the autonomy principle comes. If he is not in his senses, he is not in a good state of mind, then the safety always applies for this type of patients. Always assessment goes first before the intervention, and we should not agree with any type of delusion which is happening with the patients who are having psychiatric problems, and we should never ask why, and we should never give any false reassurances to the patient, and always we should be least restrictive options should be applied first. We are going to reorient to the patient, we are going to have a check on the patient again and again, or we are going to assign a sitter by the patient and we need to have a watch on him. In spite of all these things, also the patient is very much impulsive, he is not listening and he is very destructive, then we can get an order for restraints, that too after getting advice and consent from the physician, then only we can apply restraints to this type of patients. So we need to keep all these things in the mind before going through any psychiatric type of questions. Okay friends, thank you.